Hi. How did I get here? There was no cancer in my family. I hardly knew anybody with cancer. Of course, it's not really on your radar when you're young and invincible. After my entire life having tooth problems, as long as I can remember, trying to do everything right, rushing, going to the dentist for cleanings every 3 months, sometimes only every 6 months, losing all the teeth out of teeth, root canals, uh, crowns, later implants being put in, taken back out, jaw infections. Every new doctor, every new specialist thinks they can do it right. I've had implants put in and taken out 3 times. Finally, the last time, the doctor says, "Did you know you have lichen planus in your mouth?"
Lichen planus is a common, non contagious, inflammatory condition that can affect the skin, nails, hair, and mucous membranes. It is categorized by itchy, flat top reddish purple bumps on the skin and lacy white patches or sores in the mouth. The exact cause is unknown, but it is thought to be related to an autoimmune reaction.
I say, "Yeah, I knew that. What can we do about it?" It's when a couple of years of every doctor saying, "Did you know you had lichen planus in your mouth?" I'm like, "Yes, it's very uncomfortable. What can I do about it?" Well, nothing we can do really. We have to watch it. Okay, watch it. The very last time, I think end of 2023, September 2023, the doctor says, "I think we need to take a biopsy of your lichen planus." Okay. That already sounded kind of scary. But yeah, do it. It hurts, but it's been hurting for years, so take the biopsy. The next time I saw the doctor, he enters the room. This is a specialty periodontal place, surgery place, not just a regular dentist. He comes in, he stops at the door. From the door, I'm lying in the seat, right? He says, the bad news is that you have cancer in your mouth. I'm like, okay, what do I do now? Well, the good news is that I know a specialist, a great surgeon in another state, and I'll give you a referral to him. What struck me as really odd was that it was a nice doctor. I liked him. It's like he didn't approach me. He stayed at the doorway, like 6 to 8 feet away from me. Like me feel kind of weird. I don't know what was the reason or what happened there. It's not really contagious the last time I checked, but that was, I'm lucky like that with doctors. I'm lucky. Anyway, a flurry of scans in the end of 2023, November, doctor's appointments, pre-surgery appointments, hospital appointments, blood work, you name it, you have it. It's just up and down and sideways, and your mind is going in a million directions. I did not really ask Dr. Google, so what about mouth cancer? What can what am I looking forward to? I only did that at the very, very end, like 1 week before surgery, and I didn't like what I saw. Mostly the videos were 2 to 5 minute clips from doctors or hospitals advertising, "This is what we do. You can come with your mouth and head and neck cancer. Come to us. We'll take care of you." And it was not very, it wasn't assuring or informative, nor was it scary. It was just nothing. It there was no real information, which is one of the reasons I want to make a little series of videos just showing what I went through and maybe touching on a little bit of recent research in the area and everything that is involved that I didn't know. Nobody told me before, during, or after. Things that you find out little by little as you're going through them, and you're like in disbelief. What's going on? I don't understand. I don't compute. Anyways, on December 21st of 2023 was my first surgery. They took, I don't think you can see it, well, maybe a little bit.
Free flap surgery is a reconstructive surgical technique used in head and neck cancer treatment to repair large defects after tumor removal. It involves transplanting tissue along with its blood supply from one area of the body, donor site, to another, recipient site, to reconstruct the damaged area.
It was a free flap surgery that failed. So my piece of arm that they tried to put in my mouth, that died right then and there. So that 12-hour surgery got extended to, 16, 18-hour surgery, long time. And then they tried, I don't think you can see. Let's try this. Roll my leg, cut out a free flap. This scar is this long on my leg and put that in my cheek, and that stayed there for a while. When you have the tissue put in from another part of your body, doesn't matter where it comes from, the vein and artery, the blood vessels are being attached so that that tissue that they transfer can live. Now, they're supposed to come while you're in the hospital with a kind of a Doppler instrument and touch the inside where the new tissue is and see if there is a blood flow, which you were supposed to hear, kind of like a miniature heartbeat.
Doppler checks are a crucial part of post-operative monitoring for free flap surgery, helping to assess flap viability and ensure proper blood flow. This allows surgeons to listen to blood flow in the vessels of the flap, ensuring the artery and vein are functioning correctly.
That was supposed to be done every 4 hours for the first week or so. It seemed that in that teaching hospital that I was at, it had not been taught. So a lot of, I want to say all of the nurses did not know what to do. And were kind of fumbling around and trying their best, poor souls, to try to get it right. And sometimes we got it, sometimes not. In fact, there were days where nothing has been done, it hadn't been tested, and I'll show some pictures if I find them. I think I will find them. The new tissue that was inserted that came from my side slowly but surely died. So that took about a week or so, and that was toast. So it turns black and real ugly, and it's not working. All the while, I have a trach. I can't talk because if you have a hole here, no matter what you do, there will be no sound coming out.
A tracheostomy is a surgical procedure that creates a stoma, opening in the neck directly connecting to the trachea. This allows for a tube to be inserted, providing an alternate airway for breathing.
So I wrote down requests as I had them. That's probably enough material for another video. But anyway, they then took me in to do it over. Along with the first big surgery, I had a modified total neck dissection going all the way across.
A neck dissection is a surgical procedure to remove lymph nodes in the neck, often performed for head and neck cancers. It is done to check for cancer spread to lymph nodes, remove them, and potentially reduce the risk of cancer reoccurrence.
Modified meaning they did not take the sternocleidomastoid muscle. They left that, but they took 100 lymph nodes out of my neck and tested them all. They took a long time to test them. They have to be sliced. Somebody has to look at every slice at the histology and then record back to the top. So now my tissue all died, going back in. Meanwhile, this area was never clean. The entire cut across the neck was not clean. It was getting infected like Lotaharo. It was leaking and it was quite awful and swelling. So they fixed both at the same time. They cut this all back open, cleaned it out, sewed it back together. The other arm tried to take that tissue out, make another free flap. This, they saw right away, is not working right. So they put the same tissue right back in my arm, which was kind of nice. And then they decided to cut me open from here to all the way down here. Don't worry, I'm not going to show you. You can see a little bit of the scar. That is still connected, which is kind of fun when you work it out. If I contract my pectoral muscle, this will all contract. So my whole brain is utterly confused if I'm doing weight work or anything where I contract the chest. It's trying to contract this muscle, and it does, but it's not doing what it's supposed to do. Yeah, so I'm afraid if I do too much chest work, my cheek will grow even more. Yeah, that finally survived.
The pectoralis major myocutaneous flap is a surgical technique used to reconstruct defects, particularly in the head and neck region, by transferring a flap of skin and muscle from the chest to the affected area. It involves raising a section of the pectoralis major muscle along with its overlying skin and subcutaneous tissue and rotating or advancing it to fill the defect.
No big surprise there, because all the blood vessels and even the nervous innervation is still intact, because everything is connected. This makes for a really, really stiff neck. Like, I can turn this way, but turning this way is freakishly uncomfortable and very hard. I quite immediately tried to get the shoulders moving so that this shoulder does not freeze, which is a very common side effect, that your shoulder sort of gets so stiff that you can't move it anymore. When I was looking down, I'm looking at my calendar. So I was in and out of ICU for about 3 weeks. With the trach, they had me on the ventilator. It was, awful. There's no other way to describe it. Ventilator did not work very well for me. I'm not sure why they put me on the ventilator and felt that I could breathe fine on my own.
A ventilator, also known as a breathing machine or respirator, is a medical device that helps a person breathe when they are unable to do so on their own. Ventilators are used in various situations, including during surgery, in medical emergencies, and for individuals with lung conditions or injuries.
My breathing rate normally is quite slow, and to me the ventilator was going so fast, it was like hyperventilating me, and it's like I was fighting against it. Twice they had me on a ventilator with a few days in between where I was off, but I don't quite remember. I was quite drugged up during that time, very dehydrated and very drugged up with all kinds of good stuff. Morphine, I don't remember now. One of the side effects of radiation, which I had after, is that the memory can get funky. Sometimes I remember very well, and many times it's just not there. I'm grasping at clouds. I'm grasping at nothing. Uh, Forgive me when I swallow. The after effect of all this, which is very common, is that you are either super dry in your mouth, and it's like that's very unpleasant, and you can't talk or swallow, or like I have right now, your saliva is flowing like that, and you're afraid that you're drooling, and you get very self-conscious, and you cannot talk very well. You have to swallow a lot, which I can totally cut out, but it's probably also very educational, so I'll leave some of those in. Here's a quick shout out to Robin, my massage therapist in Cloudcroft. Uh, Swallowing is a big deal. She did something in my throat area and to the muscles and to the tissues, and all of a sudden I could swallow again without taking water, like so. I would call that a dry swallow without having to take any extra liquid in order to swallow. So that was huge, just to be able to do that. And whatever she did, it opened a new world for me, because if you can't dry swallow, you feel like you will drown on just a little teaspoon of spit, or you will get so incredibly dry that you think you are suffocating. So being able to swallow without any extra water intake is absolutely wonderful. Thank you, Robin, for giving me that ability back. And neither of us knows how we did it, how she did it. But it worked, and I'm very grateful for that. Let's see. First Day Hospital, November 21st, 2023. And I finally got out, get this, on a Sunday, the 7th of January, 2020. What a great day. To leave the hospital is just absolutely wonderful. The hospital was a nightmare, an absolute nightmare. I don't ever want to go again. Maybe one night, but if you need to keep me longer, just kill me now. It's like, no, it was it was really bad. Maybe more about that later, maybe not. I'll decide later. So you call how I was very weak. Again, I don't recall that much. They give you a recovery time uh, of about 2 to 3 weeks before you see the oncologist. I had a feeding tube because I could not eat enough calories through the mouth. The mouth opening was very small. I could not swallow very well. They did a swallow test at the hospital. The, the speech therapist does the swallow test.
A videofluoroscopic swallow study, also known as a modified barium swallow study, is a radiographic procedure used to assess swallowing function. It involves using X-rays to visualize the oral cavity, pharynx, and upper esophagus during swallowing, allowing healthcare professionals to identify problems with the swallowing.
Uh, that was that was interesting. I feel like I'm all over the place, but hey, such is life. They did a swallow test. It was a nurse and a doctor, a physician. Nurse, physician, X-ray machine. You get kind of baby food that they mix up with radioactive barium, and you go from very liquid to a little bit more structured, like really like slightly structured baby food, nothing that you would have to swallow. Uh, and they feed you, and you swallow, and the X-ray machine the entire time will take X-rays, and you'll see it on the side. The doctor is looking at it, and the nurse is looking at it, and you can see how the radioactive food goes down your throat and down the esophagus and so on. It really shows nicely how the tongue aids in swallowing, how your epiglottis moves, and then the muscles in your throat push everything down.
The epiglottis is a flap of cartilage located in the throat, just above the larynx. Its primary function is to prevent food and liquids from entering the trachea when swallowing, ensuring they go to the esophagus instead. During breathing, the epiglottis is upright, allowing air to pass into the larynx and lungs. When swallowing, it folds down to cover the entrance of the trachea, acting as a protective barrier.
I could see the food go down, but it didn't go down the esophagus, it went down the windpipe. And the entire time this was going on, the different types of food that were fed to me, the nurse and the doctor had a really good time talking and laughing and nodding and looking at the screen every so often, and they just had a really good time socializing. At the very end, I got to wipe my mouth, I got a little bit of water, and I got wheeled back to my hospital room. A day or so later, somebody came and said, yeah, you failed the swallow test. I knew that by that time because I was coughing up through the trach baby food for the 2 days it took for them to figure out that I was aspirating all the food into my lungs. When you have a trach, you have a lot of mucus. The lung specialist comes and does suction on it, where they put the tube, roughly this far, and suction it, which makes you think you are going to die because you can't breathe and it hurts, so they do that a few times a day so you can breathe again. But anyway, they were suctioning out baby food for probably a week, which is when all food consumption stopped. I got a nasal tube in for getting food in my stomach, which however that works, also ended up in my lungs, and they stopped that, so all food got stuck with that. Everything got stuck. All I got was painkiller. I did not get IV in fluid in my arm. It got so bad that I wrote down, I begged, I am dehydrated. I can I at least have an IV? I could feel that I was getting even more delirious or something because I was severely dehydrated. Oh, we have to have the okay from the doctor first. And yeah, that comes by 8 p.m. When you think about it, you can go out to town, even in the small town where we live here, and for $150 you can hook yourself up to an IV to, make your skin nice and hydrated. And you're dehydrating in the hospital, and they tell you we have to. Wow, yeah. You are beginning to understand why hospital was hell, and I don't want to go back. Anyway, where did I go? 3 weeks, about January 30th is when I went to see the oncologist. Best guy yet. Wonderful, wonderful doctor. Really great doctor. And he highly recommended that I get radiation. And I asked, so what's going to happen if I don't take the radiation? In all his sweetness, yeah, the cancer will come back. You had very, very tight margin. Usually when you do surgery in the mouth or on the nose or in the throat, salivary gland cancer, thyroid cancer, anywhere in the head you want at least a 1 centimeter margin on your cancerous tissue, which means you take out the tumor plus 1 centimeter around it. Probably as thick as my little finger, that's about a centimeter. So make sure that you get all those stray cancer cells that may be trying to leave the tumor. 1 centimeter margin is a good estimate to cut. What kind of margin did I get? A half a millimeter. That's very, very small. Probably if there was more, I would have lost even more of my face. So it's kind of like, you down if you do, down if you don't. But I had a very small margin. He says, your cancer will come back and you will die a horrible death. Very painful and very awful. And I thought, oh, fuck that shit. Alright, I'll take the radiation. 60 GI.
In radiation, gray is the unit of absorbed radiation dose, representing the amount of energy deposited by ionizing radiation per unit mass of matter. It is a key unit for measuring radiation exposure, particularly in contexts like radiation therapy and diagnostic imaging.
30 days everyday radiation in a different town, 1.5 hour drive. You don't have to go on the weekends. Monday through Friday, you have radiation. I had radiation for 30 days until April 5. So my last day, you get to ring the bell. In the beginning, radiation is not that bad. You get a mask fitted. It goes over your entire face. My mask went all the way up to here. I will show you a picture. I don't think I want to show you right now because I got PTSD.
A thermoplastic mask is frequently used during radiation therapy for head and neck cancers to ensure precise and consistent treatment delivery. This mask, custom made for each patient, helps immobilize the head and neck, minimizing movement during treatment and maximizing the radiation dose to the targeted area. While some patients may experience discomfort or anxiety, the benefits of accurate radiation delivery generally outweigh these challenges.
Putting it on, excuse me, the mask gets tightened to the table. You cannot move at all. You're trapped in there. This video shows how she is installing the soft material that makes up your mask. It will harden in just a few minutes. See how she ties it down with those snap screws? It's still soft now, but it will turn very hard in just a few minutes. There. The setup for radiation takes longer than the radiation itself. It's a very large machine that has a very direct beam to you, to your face. It's very calculated where it goes, and they set it up every time. Some people get little tattoos, like tiny little dots, where they direct the beam where it starts. So that whole setup takes a while. And then everybody leaves the room, and your big radiation machine goes around you. It does make a god awful noise while it gets around you. I swear I could feel it. Not like a vibration, but like a vibration. Like the noise was inside of me. But the entire process does not take very long. It's somewhat not nice, but also not bad at all. Uh, I think my emotional response is it's more from being tied down. You cannot move, you cannot escape. You have no choice. You're like in jail, radiation machine jail. Give me a minute. In order to save my tongue, most of my radiation obviously was I had Hugo, uh, squamous cell sarcoma up in my gum and in the side here, about that size. The tumor, uh, the radiation is very, very directed, but your tongue is in the path of the radiation. So they constructed me a little thing that I could put into my mouth and push the tongue all the way to the back. So with that in my mouth, I could kind of bite down onto it, and the tongue was as far away as we could push it. Because even if there was no surgery on the tongue, just the radiation will damage the tongue to an extent to render it quite useless. And it may not recover, it may not heal from the radiation damage. I remember I could feel the last two applications of the radiation were they got my tongue. And they hit it hard. And what did I say? My last radiation was April 5, 2024. So we're more than a year out today. Uh, June 24th, 2025, so we're more than a year out, and that side of my tongue still is very sensitive to everything, and it just still hurts every day. So those last 2 days got me. For the first 3 weeks of radiation were really not that bad. It kind of wears on you that you have to do it every day, and then all of a sudden the effects start. You get a lot of mucus inside your entire head, nose, throat, lungs, the back of your neck, the hair starts falling out. Imagine the wind coming in and it kind of hits the back of so all the back of my hair was gone and it took quite a while to come back. The pain starts inside the mouth. You get blisters. I remember I had the feeding tube, so I didn't really have to eat anything by mouth. And I could just put anything, protein shakes, etc. to my peg.
A percutaneous endoscopic gastromy is a surgery to place a feeding tube. Feeding tubes, or PEG tubes, allow you to receive nutrition through your stomach. You may need a PEG tube if you have difficulty swallowing or can't get all the nutrition you need by mouth.
Uh, yeah, it started to get annoying. I think it wears on you psychologically and it wears on you physically. Every time you get radiation, the effect is accumulative, but it doesn't go in a linear line, it goes exponentially. At the very end, I begged him, look, I have only one more day. Can I skip it? I really, really don't want to call. And he says, no, the last one is your most important one. All the other ones, all 29 before, the last one is as much as all the ones before. Take it. Alright, I'll take it. Uh, last one. It wasn't easy. I did not know. I'll have to look up if there are statistics, but many people don't. They cannot take it.
A significant portion of patients with head and neck cancer do not complete their radiation therapy as prescribed. Studies indicate that nearly 40% of Medicare patients with head and neck cancer experience interruptions or fail to complete their radiation treatment. Patient noncompliance, medical comorbidity, and the radiation therapy toxicity are the primary reasons for premature discontinuation of treatment.
I think I got pretty lucky. The last 60 years or so, I don't use makeup or anything. Uh, I put some skin lotion on. The cheek was better. I exfoliate with a scrubby sponge. That's it. So, in other words, my skin for the last 56 years has not been very protected in the face. I think if you are used to wearing foundation and makeup, etc., for many decades, you protect the skin on your face so that it's not used to assault by sun radiation, weather, wind, you name it, chemicals. But for radiation, you cannot wear anything on your face. No lotion, no foundation, no makeup, nothing. You have to be completely bare, which in my case was my normal. Nothing changed. But many people their skin is not used to being exposed like that. So when they get radiation for 30 days in a row, their skin starts burning and blistering and can turn really, really damaged. I had some, I want to say like a rash from here to maybe down here. Uh, like dead skin, like a really thin layer of dead skin that you would have like a callus. Uh, but it really wasn't that painful or that bad. It was just kind of ugly. It was dark, but hey, nothing serious. And I would think it's because my skin is exposed to sun radiation and wind and weather and whatnot, all kinds of abuse during the day for decades and decades, and it never was protected like that. So maybe the epidermis was a little stronger in that case, and I didn't get as much radiation damage on the outside. Inside, yeah, Inside is a different deal. So that was that was hallelujah when that was over. I had a lot of help from friends and family. Half the neighborhood drove me. You cannot expect just one person to drive you to your appointment every day. That's too much to ask. So thank you to everybody who gave me a ride that's 3 hours out of your day just driving uh, your neighbor or friend or wife or mother or mother-in-law around. Thank you so much. At that time, I wasn't very entertaining. I could not really talk that well. I was very tired. Yes, radiation makes you tired. I think uh, being in the hospital with 3 or 4 different surgeries, having that many uh, full anesthesia for that many hours, at least 24, 30 hours to be under, and then the radiation. It kind of wears on you. You get tired easily. You're not very entertained. At that point, I could still open my mouth fairly well. One side effect of radiation is that your tissue turns, it causes fibrosis, which is uh, the fibers that hold your tissue together They get very stiff, stick together, and don't move.
Trismus, commonly known as lockjaw, is a condition characterized by the inability to fully open the mouth due to muscle spasms or stiffness in the jaw. It can result from various causes, including tetanus, head and neck cancer, or treatments like radiation therapy. Symptoms include jaw pain, difficulty chewing, speaking, and maintaining oral hygiene.
Usually your tissue is like soft. Everything moves. Fibrosis, you can't move. It gets very hard. In my case, this entire area is like a brick going down here. It's very, very hard. It affects your jaw joint, so I can't really eat whole spoon because I can get a tiny spoon in my mouth, but not with food on it. uh, yeah. I'll show you how I eat in a different video. We overcome all sorts of challenges. But anyway, after you finish your radiation, you're kind of like, hallelujah, that's done. And you still have that feeling, oh, it's done, right? It's gonna get better from now on. There is no sweet or salty or sour or bitter. I just touched my ear because it hurts. Maybe the memory of it. Your ear can hurt. Your throat hurts. Ever had a little ear infection? You know the stabbing pain. Yeah, you can get that. Headaches. Every possible nasty side effect that finally reaches you from the radiation intensifies in the 2 weeks after radiation stops. When you finally think, I think I'm done with this thing they call life because this is not worth it, I cannot eat or speak or kiss or talk or drink. I can't really do anything. That's when it starts getting better. You wake up and you feel just a touch less shitty when you get up. Okay. I'll take that. And a while through your day, and then the next day, you feel a little bit better. And then maybe the next day, you could swallow. And then the day after, you didn't think you died 50 times a day because your phlegm, you had too much phlegm, you couldn't cough it up anymore. Oh, did I mention? Radiation also makes you throw up. I said I had a feeding tube, so that was no problem, right? You can. I had these protein shakes, high calorie protein shakes. They are easy. You just put it in your tube and you're done. Nothing has to go through the mouth. It's a really practical thing for when you can't eat and you need a lot of calories. Boy, I did need a lot of calories. But I don't know if it was the shakes or in combination with the radiation. Swell made me nauseous at the end of last week, and then the 2 weeks after, I was throwing up a lot, and it is nasty. Remember, you're raw inside. Getting the food into your tube, that's great. But if the food comes back up with a stomach acid, yeah, that's not so great. It's not a good feeling. It did not last very long. I stopped the shakes. I started making my own with probably more healthier options. Uh, and it smelled differently. Even if you do tube cleaning, kind of like burping, you still get the taste, the smell of the food coming up from your stomach, so you can kind of get a sensation of the taste or smell. So if you connect one particular smell with getting nauseous, then if you switch up the taste or smell, even though you don't eat it from the mouth, can help with the nausea. The all the different pills that I have for anti-nausea, yeah, I threw them up too. They didn't really help that much. You know what, guys and girls? I think this video has been long enough. I'm getting a little bit tired of talking. I may cut in what I'm missing. I already have a lot of things in my head that I know I forgot to mention, so you will see me with a different shirt, which is really no big deal whatsoever. Uh, and there I got a little bit too emotional recalling another instance of what happened in the hospital, so I'm just gonna have to call it a day for now, and that was a really long video. I hope you enjoyed following along a little bit, and I hope there are some little things that help you, whether you've been there or you're going into it, and looking forward to seeing you again in my next video, which will be a lot shorter, I promise. See ya.